A prescription refill can look as though it is already being handled. The pharmacy app says the request was sent. Your parent remembers talking with the doctor's office. Then a few days later, the medication still is not ready, and only a small number of doses remain. The difficulty is that a refill is not one single action. Several steps may have to line up before medication can be picked up or delivered. By the end of this video, you will know how to look at the supply, the prescription, and the pharmacy or insurance process separately, so you can identify what is holding things up and ask the right person what needs to happen next. Every refill has 3 different timelines. The first is the supply timeline. How much medication is physically left and how long should it last under the current directions? That can become unclear when the dose has changed, the medicine is taken only when needed, or more than one bottle is in the home. The second is the prescription timeline. Even when medication remains, the pharmacy may not have authorization to dispense another supply. The prescription may have no refills left, may have expired, or may require an appointment, laboratory work, or another clinical review before the prescriber issues a new one. The third is the fulfillment timeline. The pharmacy may have a valid prescription and still be unable to complete the refill immediately. The medication may be out of stock. The insurance plan may say it is too early. A prior authorization or quantity limit may need attention. A mail order prescription may require several days for processing and delivery. This is why the refill was requested does not necessarily mean the problem is finished. A request does not confirm that the prescription is valid, the claim was accepted, the medication is available, or the order is ready. Once you understand those timelines, make sure the family has the right information. A basic medication list is useful, but it may not contain enough detail to manage a refill. A refill-ready record can include the medication name, strength, current directions, prescriber, pharmacy, prescription number, quantity dispensed, last fill or pickup date, and refills remaining. When available, also note the day's supply, next refill eligibility date, whether it is filled locally or by mail, and any known renewal requirement. The record should reflect what the parent is currently taking, not everything that appears in a pharmacy history. A profile may contain an old strength, a short-term medication, or a prescription that was replaced. Suppose you find 2 bottles with the same medication name but different strengths. Do not choose the bottle that looks newer or assume the higher strength replaced the lower one. The parent, pharmacist, or prescriber may need to clarify which instructions are current. The record helps you recognize the question. It does not authorize anyone to change, stop, restart, combine, or ration medication without appropriate clinical guidance. The record also helps determine when to begin. The important date is not always the day the bottle becomes empty. For medication taken on a regular schedule, estimate the remaining supply by dividing the quantity left by the number taken each day. If 12 tablets remain and the directions say 1 tablet daily, that suggests about 12 days. But this is only an estimate. It may not work neatly for inhalers, drops, creams, injections, variable doses, or medicines taken only when needed. Then consider the likely lead time. Does the prescriber's office need several business days? Is a weekend or holiday approaching? Does the medication come by mail? Has it required prior authorization before? Is travel planned? There is no single early refill rule for every medication. A useful review date leaves enough time for the steps likely to apply. The pharmacy and plan can explain when a claim may be processed, while the prescriber can explain whether an appointment, laboratory result, or review is required. For example, a parent may have 12 days of medication left, but the bottle shows no remaining refills and delivery usually takes a week. Waiting until only 2 or 3 doses remain leaves little room for the prescriber to respond and the package to arrive. When a refill stalls, the most useful question is not simply, "Why isn't it ready?" Ask what specific issue is preventing completion. No refills remaining usually means the pharmacy needs a new prescription. Ask whether a renewal request was already sent, when, and how. Refill too soon usually means the pharmacy or insurance system believes the current supply should not be finished. Ask for the next eligible processing date and the day's supply submitted. If the dose changed, medication was lost, or travel is involved, ask whether a special process applies. Approval is not automatic. A prior authorization, step therapy rule, or quantity limit usually involves both the drug plan and the prescriber. The pharmacist may explain the rejection message, but the prescriber may need to provide information, and the plan makes the coverage decision. If the medication is out of stock, ask when it is expected, whether another location may have it, whether a transfer is allowed, and whether the prescriber must send a new prescription elsewhere. Controlled medications may have stricter timing, refill, transfer, and identification requirements under federal law, state law, and pharmacy policy. Federal rules do not allow refills for Schedule II prescriptions, while Schedule III and Schedule IV prescriptions have federal limits. The pharmacist and prescriber should explain what applies to the specific medication and location. A helpful question is, what exactly is blocking this prescription? Who needs to act next? And what should we expect after that? That question leads to the next part of the process, following the handoff until it is complete. A voicemail does not mean the prescription was renewed. A pharmacy message saying it contacted the office does not confirm the office received the request. A plan approval does not guarantee that the pharmacy has the medication. Keep a brief status note with the date, organization contacted, issue reported, action promised, person responsible next, and follow-up date. The purpose is not to build a complicated file or assign blame. It is to replace vague statements with a clear next step. Consider a common situation. The pharmacy says it sent a renewal request on Monday. The prescriber's office cannot find it. Instead of asking both sides whether they sent or received something, confirm the medication, pharmacy location, prescriber, date of transmission, and preferred renewal method. Then record what each party agreed to do. The loop is closed only when there is a real outcome. The medication may be ready, delivered, or picked up. The prescriber may require an appointment. The medication may have been changed or discontinued. Update the record so the family is not following an outdated plan. Convenient services can reduce work, but they are not guarantees. Automatic refill may start a new fill when usable refills remain. It does not necessarily renew an expired prescription, resolve prior authorization, or confirm that the parent still takes the medication. Medication synchronization can arrange several prescriptions for pickup around the same time. Insurance rules, specialty drugs, controlled medications, short fills, and clinical requirements may prevent every prescription from following one schedule. Mail order and delivery add other questions. Is the address correct? How long does shipping take? Does someone need to be present? What happens if the package is delayed? When travel is planned, ask the plan, pharmacy, and prescriber early rather than assuming an early supply will be approved. Throughout this process, the parent's privacy and choices still matter. When the parent has the ability and authority to decide, ask what kind of help they want. They may welcome reminders, but prefer to speak with the pharmacist themselves. They may want you to pick up prescriptions without giving access to the full pharmacy account. Federal privacy guidance generally allows a pharmacy to give a filled prescription to a family member, friend, or other person the patient sends. That practical permission does not automatically provide unrestricted access to the parent's entire medical or pharmacy record. The pharmacy may also have identification requirements, especially for certain controlled medications. Ask the pharmacy how the parent can give permission for refill discussions, who may receive notifications, what is required for pickup, and how an outdated prescription can be marked inactive. Some situations need prompt clarification from a pharmacist or prescriber. These include conflicting directions, two active strengths, a prescription that continues to refill after it was believed discontinued, an unexpected change in appearance, or uncertainty about which bottle is current. A hospital stay can change several medications at once. That may require formal medication reconciliation, which belongs in the separate hospital discharge episode rather than being resolved through a refill tracker alone. For further research, the National Institute on Aging and the Agency for Healthcare Research and Quality provide medication list and caregiver worksheets. The Food and Drug Administration explains how pharmacists help people use medicine safely. Medicare provides information about drug plan rules in mail-order pharmacies. The Department of Health and Human Services explains privacy considerations for family pickup, and state boards of pharmacy can clarify state requirements. Direct links are in the description. This video provides general education, not individualized medical, pharmacy, insurance, privacy, or legal advice. The correct next step may depend on the medication, the parent's health needs, the insurance plan, pharmacy policy, and federal or state law. Without naming a medication or sharing private health information, what refill message or pharmacy status has been hardest for your family to understand? A thoughtful question or practical lesson in the comments may help another listener know what to clarify earlier. The central lesson is not to treat a refill as one vague task. Check the remaining supply, confirm the prescription authority, identify the fulfillment barrier, and follow the handoff until there is a clear outcome. That is how a last-minute mystery becomes a process the family can understand.